Hi, so I am recording this masterclass on a technical point around baby massage that's been coming up from some of my students, some of the teachers in my community, and I just wanted to spend some time just clarifying my knowledge and understanding of the situation, just because the health and safety of our mums and babies is always our number one priority. So you might be watching this live on Facebook, you might be watching this live on Insta if you are, hello, or I'm going to be embedding this video into our course, so you might be watching this on your course as well. So what am I going to talk about today? Well, what I want to clear up is there was a little bit of a debate around 5 or 6 years ago about the direction of strokes for baby massage on babies' legs. So I'm going to fill you in a little bit on the history around that, where that debate came from, and then I'm going to talk about what we advise as a fully accredited and insured training provider in relation to baby massage on babies' legs, so that we can be confident that we have really high quality, safe practice for baby massage and baby yoga. So if we go back maybe 5 or 6 years ago, there was a article published that suggested that when you are massaging a baby's legs, you should only massage towards the direction of baby's heart. So that would be from the ankles to the thigh, using what is known as Swedish massage. Now, if you're new to baby massage and you don't know or you're new to massage completely, you might not appreciate that there's many different types of massage that come from lots of different cultures, lots of different traditions, and they all obviously are based around touch, therapeutic touch, and working on soft tissue. But some of the practices have come from different they come from different traditions, and so you can see quite a lot of variation in the way that people provide massage. And you probably, if you've been for a massage yourself, you can see you can have Indian massage, you can have holistic massage, you can have Swedish massage, you can have sports massage, Thai massage. There's so many different types of massage out there. So baby massage is generally based on the traditional practice of Indian baby massage. That's where it came from initially. The person who brought it over and introduced it to the world is Vimala McClure, who's the founder of the AIAM, who I trained with about 18 years ago, and she actually introduced it to the West as the first training program and offered classes within the community. At the same time, massage and touch was also being used in a lot of hospital settings as part of kangaroo mother care. And Tiffany Field, who's a very prominent researcher in this area, did a lot of research at the time around baby massage and premature babies. So the traditional baby massage comes from the practice of Indian massage. Now, Indian massage generally works away from the heart, so it would be from the shoulder to the wrist and from the hips to the ankle. And the reason why the massage is performed that way is because it's also Indian massage also has quite a lot of energetic practice embedded within it, in that if we're holding tension or stress within the body, we want to release that and draw it out of the body, and so the strokes move away from the heart rather than towards the heart. And as I said, most of the baby massage classes that you would go to around the world are based on this traditional Indian massage routine which was created by Vimala McClure in the 1970s, now a long time ago. But then we also have in the massage routine that we teach Swedish massage. So Swedish massage came about much later, sort of at the beginning of the 1900s, and it was a sort of a practice that developed off the back of physiotherapy and a lot of rehabilitation that occurred from particularly soldiers coming back from the First World War, and massage was used as part of rehabilitation and physiotherapy. And then from that, it developed into its own sort of practice of Swedish massage. And so Swedish massage largely works towards the heart to aid boosting circulation back to the heart, boosting lymphatic drainage. So that is from the ankles to the hips and from the wrist to the shoulder. So you're always working on boosting circulation and helping with lymphatic drainage and that flow. So it's a bit of a contradiction, really, because you've got two different types of practices embedded within the baby massage routine, and this is where some of the debate and controversy came from a few years ago. Now, the routine that we teach at Blossom and Berry has elements of Swedish massage, it has elements of Indian massage, it also has some baby reflexology, it also has some baby yoga, and we use lots of songs and rhymes and also still touch and breathing techniques and warm-up stretches for mums as well. So our course is a kind of hybrid of lots of different types of learning that we've developed in our own way over the last 18 years, which is it's pretty amazing when I say it like that. So back to then the health and safety considerations. So as I said, there was a bit of a debate 5 or 6 years ago which suggested that if you massage a baby's legs away from the heart using Indian massage, what you could potentially do is damage the valves that are in the veins, which are blood vessels in babies' legs that transport deoxygenated blood around the body. You can potentially damage those valves, because if you imagine that the veins are a big tube, the valves are stacked up like this, and what they do is, as the blood returns back to the heart, which obviously it's a bit tricky to do that when it's going from the bottom of the body back towards the heart, the valves actually stop the blood flow from falling back down. So they if you imagine that the blood goes up, the valve then clicks in so it doesn't fall down, then it goes up again and up again like this. Okay, so all the valves are going up. So a little bit like if you were trying to push fluid up a straw and you squeezed it, it would be the opening and closing of your fingers is a bit like the valves that allows the blood to flow back up towards the heart. Now, the suggestion was that if you practice traditional Indian baby massage, you would be massaging down. So where the valves are all stacked up in the right direction, you would be pushing those valves in the opposite direction, and potentially you could damage those valves and restrict or damage or affect baby's circulatory system. Some people were suggesting that it could cause pooling of blood, and obviously if you have blood pooling, that can lead to some propensity to DVT in a worst case scenario. So basically, if you think about it, with baby massage, what we're doing is we're supporting baby's health and well-being, we're supporting the development of baby's body, we're supporting circulation, we're supporting lymphatic drainage. So it would only make sense to only do strokes which are supportive and positive on baby's body, nothing that would cause any hurt or harm. So as a result, at the time, there was some discussion as to whether we should massage baby's legs using Indian massage from the hip to the shoulder. Now, also, at the same time, there was a counter argument which said that because baby massage originally comes from India, and because it's been practiced in this way for hundreds of years, and there's also many other examples across the world where babies are massaged at birth. They're welcomed into the world by birth attendants who actually, massage them all over to stimulate the circulatory system, respiratory system, lymphatic system. And if you see, sometimes if you've had a baby or if you've seen births on the television, if babies aren't very responsive at birth, one of the first things that midwives do is they rub the babies with a towel to stimulate the skin, and in stimulating the skin, you stimulate the nervous system, which then kicks in to communicate to all of the other body systems, that it's now time to activate these systems because baby has now been born. And so, the use of touch around babies is just very intuitive and instinctive and used in many, many cultures around the world. So the counter argument was, because it's actually been used like this in India for hundreds of years, and there's no recorded or any research that's been done to show that babies, as a result of only receiving Indian massage, i.e. the strokes from the hip to the ankle, have had any more There's never been a propensity to circulatory issues, DVTs, anything like that. There's not any actual studies that show that this is what has happened as a result of it. So I completely and utterly understand the theory, which is based on anatomy and physiology. And Swedish massage is based on anatomy and physiology. As I said, it doesn't really look at the energetic flow throughout the body. It's based on what we know, which is that blood needs to return back to the heart, and that lymphatic drainage also works in that direction as well, and we drain into the lymph nodes. So it's all based on anatomy and physiology, and Indian massage tends to be more based on obviously physical health, but also our energetic health as well. So as a result, it was a little bit confusing because, you know, on one side with my science brain and my anatomy and physiology brain, which I love all of that, and it's embedded into all of our courses, I can totally understand the science. But then in the actual cultural practice is that, you know, we haven't actually seen any evidence of what happens when we do this. Like, does it actually cause these results which we're worried about? Does it actually cause babies to have a affect their circulatory system? Does it damage their circulatory system? Are we putting babies at risk? Because let's remember, that's why we would, you know, that's our number one priority, is to protect the health and well-being of babies, give the best advice and education to our clients, and not put babies at risk at all. So as a result, it was quite difficult because it was left quite open-ended. It was just open guidance. And to be honest, I've never really heard too much else about this in the last 5 to 6 years. Like, there's never been any bulletins on it. There's never been any advice from the insurance companies, any other bodies. So it was kind of left to training providers to take their own stance on this. So what I decided for Blossom and Berry is that I wanted to honour the tradition of Indian baby massage, because, you know, that's where the practice comes from. That's where the roots are. So I didn't want to, you know, dismiss that, because obviously that's the heritage, and that's where we learned that practice from and created it into the style of baby massage classes that we teach in the West largely. But I also didn't want to ignore science and research as well. So what the advice that I give my teachers is this: that we can do a combination of both Swedish and the Indian massage strokes on babies' legs. But if there is any history, and we always take a full medical history before we begin classes, if there's any history of blood clots, circulatory problems, if there's any issues that a parent feels concerned about around circulation on babies' legs, all we would do is, where we do 2 strokes of Indian massage at the beginning to begin the routine from the hip to the shoulder, we would just literally just replace that and do 2 more Swedish. So that's it. That's the way that you can get round or protect your practice, protect your protect the health and safety of babies, put health and safety of babies first, is to just, you know, honour both the Indian and the Swedish. But if there's any complications, we are going to just drop out that Indian particular stroke, which is called Indian milking or Indian draining. And we are going to replace it with the Swedish style. So that allows us, as I said, to honour the research and the tradition, to have safe practice, also to educate parents and babies as to why it's important, and, you know, that we understand this, and that we understand anatomy and physiology. So it's a really important learning point, and it's also really good to be able to explain to parents, you know, why do we do strokes in the way we do? What is the history of baby massage? Where does it come from? And we cover all of that in our courses as well, because it's very important to, you know, put everything in context, because when we understand why we do something and the benefits, it really motivates us to do it more, and we become more consciously connected with the daily practice, and we embody the theory. As I always talk about, we put love into action when we practice baby massage, and that's so important. So I hope that answers any of your questions on that issue. You may not even be aware of it, because it was 5 or 6 years ago then, like I said, that study and that research and that debate came out, and it's really kind of disappeared. But because I read everything, and because I want to make sure that my teachers are absolutely giving the right advice and that they are up to date with all knowledge and information. I just want to be really mindful of always checking in with our clients, always making sure our clients are comfortable, the mummies and daddies are comfortable with what they're doing in the class, why they're doing it in the class, and that we know that mums and that babies are very are safe, and that babies are healthy and happy before we begin the massage. So I hope this summarised that for you. If anyone's got any questions, do pop them in the box. But I'm going to be putting this, as I said, we're embedding this video into the course as a little update. So if you're watching it now live, or you might be watching it in the course a bit later on. And so this should shed a little bit of light on some of the questions that we ask in our course, because we really want to, as I said, we really want to make sure that you're not teaching baby massage superficially. We want to make sure that you really truly understand what it is, and that's why our courses are 3 months long in length. We have so many different types of questions that you need to answer. We have case studies. We're accredited by the Royal College of Midwives, Federation of Holistic Therapists, because we do spend time looking at all the research studies. We embed those in our courses, so that it's not just about coming and doing and it's not just another baby class, baby massage. It's actually all about love, connection, presence, community, but it's also about supporting baby's physical well-being as well, and strengthening the muscles in the legs and helping to develop strong healthy bones, promote really good digestion, helping with lymphatic drainage, improving the condition of the skin. So many things that you get when you come along to a baby massage class. It is absolutely fantastic. So haven't got any questions today, but I'll be interested if you want to ask me any questions on this. You're welcome to DM me. Otherwise, I hope this has been useful for you, and I'm going to end the video now. So I will catch you later, guys, on Insta, and I'll see you guys later on Facebook.